Does your work requires you to stand on your feet for a long hours and you have started getting pain on your back of the heel? Hi, I am Dr. Sheetal Mundada and watch this video to know the best way to understand and treat Achilles tendonitis. Achilles tendonitis is an overuse injury of non-elastic band which links from the muscle of your calf to foot behind your feet. This cord-like structure which connects the calf muscle to the back of your heel gets thickened, irritable, swollen or even sometimes torn due to repetitive wear and tear, overload or stress on walking, running or jumping. You get pain behind your heel and which does not allow you to do your activities. This pain and stiffness increases due to increase in an activities like athletic or recreational activity like jumping, running or prolonged walking. Achilles tendon gets sore and stiff when you get up in the morning and take your first step out of your bed. Bending of your ankle becomes painful and you might hear a pop sound while moving it. You are wearing the wrong shoes is the first advice you get when you tell the people about your heel pain. Wearing high heels shortens the normal length of Achilles tendons, making it tight. But we know that it is one of the reasons. You are at a high risk of pain if you are a light player, an athlete or a sports person, but you might develop Achilles pain if you are new to sports. If you have suddenly increased the intensity of exercises, your calf muscles are tight or you are continuously practicing on rough or uneven surfaces, be aware of this pain behind your heel. Your exercise regime should be inclusive of the eccentric strengthening exercises of your calf muscle like heel raises, which takes the extra load off the Achilles tendon. Exercises allowing stress distribution like hydrotherapy will help in reducing pain and weakness of calf and foot muscles, making the use of buoyancy of water and reducing load. Stretching exercises of Achilles tendon and calf muscle will enhance the flexibility by reducing the stiffness and soreness behind the heel area. Ankle toe pumps in the pain-free limit will help in restoring the movement range of ankle joint. Wearing comfortable shoes that fits you properly, indulge in physical activities within your pain tolerance limit till you get healed. I hope this video helped you to find the answers to your heel pain. Don't forget to leave your comments to share your views and queries down in the comment section. For more such educational videos, don't forget to subscribe to your physio.